Hi, this is Dr. Silvester at the Next Step Foot and Ankle Clinic, and I'm going to introduce myself to you a little bit so you can kind of get to know me and know a little bit more about why I became a podiatrist and what we do here. First of all, the story of why I became a podiatrist is that I was in college and I had an ankle problem, and because I was on a sports team, I had access to our college trainer, and then also I had access to the orthopedic surgeon that was assigned to our team. And they treated me for a while and didn't really take much interest in me because I was probably not very good at sports as I should have been, so I wasn't one of their elite athletes. So a friend of mine suggested I maybe visit with a podiatrist, so I did. And I was very impressed with how attentive he was and his knowledge, and he was able to get me started on a treatment program that helped quite a bit fairly quickly. So at the time I was looking for a career in medicine, and I thought, well, I'll ask this guy if I can come over and watch him work for a while, and he was kind enough to let me do that. And I spent the next 2 or 3 weeks in his office seeing patients and walking around with him and asking questions, and it was a terrific experience for me. So I decided to go to podiatry school. So my wife and I packed up, and a year later we went to podiatry school, and now we're here in South Texas. I like being a podiatrist because, first of all, the career is always changing. The things we do this year are much different than I did even 5 years ago. There's a lot of advancements that I've been able to incorporate into my practice. There's always things that are new and exciting coming down the pike that help me provide better service and get my patients better. I love coming to work. My favorite day of the week is Monday because I get a whole week of seeing patients and being able to help people, and it's very rewarding. Our practice here is oriented towards our patients. We try to take care of their problems and worry about what's bothering them and try to fit our programs and our treatments into their lives to make their life better. So that's kind of a nutshell why I like being a podiatrist and what brought me to this career. In my practice, I specialize in the treatment of neuropathy, flat foot conditions, and diabetic feet, and especially people with diabetic foot ulcers. We also do all other kind of standard podiatry things like fixing digital deformities like bunions and hammer toes. We're pretty aggressive in that. But if you have a foot or ankle problem, or if you're having pain that isn't getting better, please consider us as a source for both education through our website and as possible treatment at our clinic. Thanks for listening.